Well, I am very delighted to welcome you and to see you here. The news is the weather, but we are very pleased that you made it and made it in safely, and we have a good turnout. Um, this workshop is being um, live on the web, so people will be joining this workshop via the internet, and we are very delighted to have that. I'm Maxine Hayes, and I am the State Health Officer for Washington State Department of Health, and had the privilege of chairing the committee that planned this workshop today. I'd like to acknowledge all members of the committee, and they will be participating throughout the day in various roles, primarily moderating a number of panels that we've organized. But I invite you to look at their bios in the little notebook that you were given. We had a very diverse set of perspectives in terms of thinking through this workshop. So we anticipate a very provocative conversation and over the course of these 2 days. I'd like to do a couple of things to start us off, and that is to refer to this infographic that is being projected. And I'd like to also just tell you that we had intended to have these posters available to hand out today. We don't have them, but we will make sure that attendees who are interested will get a copy after this is done. Let me just review for everyone the purpose of the workshop so that we start this conversation with everyone being on the right page. Having done this before for the academies, I know that oftentimes we really want the workshop to answer some questions that we were not asked to consider. It's very easy to have a set of expectations that are not in alignment with what the assignment really is. So this is the beginning, hopefully, of a number of conversations. But what we were asked to do was this. We were to review and update the 1982 IOM National Research Council report on research issues in the assessment of birth settings. So that was the assignment. We haven't had an assessment since 1982, and that's been quite a while. And as you know, things around us are evolving and changing. We will have presentations in this workshop from invited speakers, and we will follow those presentations by discussions that will highlight research findings that really help advance our understanding of the effects of maternal care services in different types of institutional settings on maternal labor, clinical and other birth procedures, and birth outcomes. These settings include conventional hospital labor and delivery wards. They also include alternative birth settings that may be hospital affiliated or may be freestanding, and home births. So that's really the scope, the gamut of these different settings. And foremost, I'd like to start by thanking the W.K. Kellogg Foundation for their support. And I'd like now to introduce the program officer, Patrick Simpson, who is in charge of Kellogg's Food, Health, and Well-Being. Let me just tell you a little bit about Patrick, and I have had the pleasure of knowing him for a very long time. He is the program officer, as I said, at the Kellogg Foundation in Battle Creek, Michigan. And as a member of the Food, Health, and Well-Being team, he serves as a convener, a collaborator, and a catalyst responsible for nurturing opportunities for effecting positive systemic changes in communities and executing programming efforts align with the foundation's mission. His focus is primarily on funding opportunities that enable the foundation to make progress in ensuring that all children can grow and thrive by having love, good parenting, high quality food, physical activity, interaction with nature, and access to health care. Prior to joining the foundation in 2010, Patrick spent nearly 15 years with City Match in Omaha, Nebraska, an organization focusing on maternal and child health needs in U.S. urban areas. And it was in this role that I first met him. He has held positions in City Match, including executive director, the director of operations, program and policy manager, project coordinator for policy and research. And since 2007, he has also been an instructor of child health policy at the University of Nebraska Medical Center, the Department of Pediatrics. Pat holds a bachelor's degree in biology from the University of Nebraska at Omaha and a master's in public health from the University of Alabama at Birmingham. Let us welcome Patrick Simpson, and he will start us off by providing a few words. Thank you so much, Patrick, for being here.